Think about a dam holding back this massive reservoir.
Right, looks perfectly calm on the surface.
Exactly. But underneath, the pressure is just quietly, relentlessly building against the concrete. You don't realize there's a problem until the wall actually cracks. Welcome to today's custom deep dive for you. We're looking at Africa's non-communicable disease epidemic, specifically hypertension.
Yeah, and how AfriPharm Health is trying to basically rewire the healthcare infrastructure to, stop those cracks before they ever form.
Right. Our mission today is to unpack why that phase of just feeling fine is actually a massive clinical risk.
And how shifting from a totally reactive healthcare model to a proactive infrastructure can honestly save millions of lives and livelihoods.
Because it's one thing to, know your blood pressure is high. It's entirely another to actually get it treated when the system around you fights you at every single step.
Oh, absolutely. I mean, you have 130 million adults in Sub-Saharan Africa dealing with this invisible pressure, and the barrier isn't a lack of education.
No, not at all. Take Fatima in Tanzania. She's a biology teacher. She understands the whole physiology of the silent killer perfectly.
But she still hasn't had her blood pressure checked in 2 years.
Right. Because getting checked usually means giving up half a day's wages just to sit in a crowded, incredibly slow public hospital waiting room.
And if you're someone like Emmanuel, a contractor in Ghana, or Amara, who trades in a sweltering Zambian market, you literally cannot afford to lose that time.
Yeah, Amara gets these chronic headaches, but just brushes them off as the noise and heat of the market.
Well, and Emmanuel actually had his high blood pressure flagged like 14 months ago, but since he feels physically fine today, going back to a clinic makes zero economic sense to him.
Which is terrifying. And then there's the sheer psychological weight of it all. Like Dele, a civil servant in Nigeria.
Right, his situation is so tough.
Yeah, he knows his genetic risk intimately because his dad died of a stroke at 61. He lives with the dread of that ticking clock, but he's totally paralyzed by the logistics.
Private clinics cost a fortune, and public care takes hours he just doesn't have.
So he just waits, hoping the dam holds.
Hmm.
It's like driving a car with a broken check engine light.
That is the perfect analogy. The internal damage is building, risking stroke, heart attack, kidney failure. But because the car still drives smoothly, you don't pull over.
Which basically defines a reactive healthcare model. It waits for the emergency.
Exactly. It forces patients to endure insane financial and logistical friction and fails millions of people. It's a systemic failure, not personal negligence.
Okay, wait, let me push back a bit here. In places like Zambia, there is only one cardiologist for every 2 million people.
Yeah, the doctor shortage is severe.
Right, so with a gap that huge, how could any system possibly catch everyone before they get sick? Who is going to monitor them?
Well, human doctors alone obviously can't. That exact resource shortage is why AfriPharm built this new infrastructure called the Care Grid.
To automatically intercept the crisis.
Exactly. Instead of waiting for a patient to walk into a clinic, it uses an AI layer named Dr. Cheerful to bridge the gap.
Okay, Dr. Cheerful. Walk me through how that actually functions on the ground for someone like Amara.
So Dr. Cheerful reaches out proactively via her phone, speaking her local language, whether that's Hausa, Swahili, you name it. It removes the cue entirely.
But wait, she still needs her blood pressure physically measured, right?
Yeah.
An AI can't take a pulse over a voice call.
Good point. To solve that, the Care Grid partners with local pharmacies and sets up these micro kiosks right where people live and work.
Oh, wow.
Yeah, so Amara takes 5 minutes to get a reading at a nearby market stall. That basic reading is instantly logged via SMS.
And then the AI takes over.
Right. Dr. Cheerful follows up via phone, monitors her trends, checks for symptoms. The hospital queue is completely eliminated.
That handles the monitoring side. But what happens when the AI actually detects a dangerous spike in her blood pressure?
Her data is routed into a health vault, which is anchored on the blockchain.
Wait, blockchain?
Yeah, because in many rural regions, medical records are highly fragmented, just paper files scattered across clinics that don't talk to each other. Blockchain provides a secure ledger.
So her health data becomes instantly accessible to a virtual care network, meaning a remote specialist can pull up her file from anywhere.
Yes. The specialist reviews the AI's flag and can intervene with a prescription before Amar's condition turns into a stroke.
Wow. And that proactive model completely bypasses the crazy costs of emergency private care.
Exactly. It prevents the kind of catastrophic financial ruin families face when a stroke hits out of nowhere.
We all tend to procrastinate on our preventive care. It's
Mhm.
just human nature to avoid the hassle.
For sure.
But this infrastructure proves that stripping away that friction isn't just about convenience. It's literally life-saving.
It completely redefines the timeline of healthcare. You treat the invisible pressure before the surface cracks.
Which leaves you with a pretty wild thought to mull over. If AI and remote grids can routinely intercept and treat these conditions before a patient ever feels a single symptom, will the traditional hospital waiting room eventually become a relic of the past?